The Research Institute itself provides two functions, research administration and research support. And my role as Head of Research is to oversee both of those areas, but also to act as Research Manager for the Board, and that's about reviewing and approving research projects. So we approve about 35 to 40 each year, and our stated ambition is to make sure, or to try and make sure that there's a research project available for most patients as they attend the Jubilee, just to give them a way of accessing new devices or new drugs which might help them in the recovery from whichever disease they happen to have.
I'm the Orthopaedic Research Coordinator, which means that I look after all of the research that is done within the orthopaedic department. We are mostly doing studies which are investigator initiated, which means that they're ideas that the surgeons themselves come up with. So they're all sponsored by the hospital, but usually funded by the manufacturers of the implants that we use. The follow-up can be quite short term or it can be long term, for example up to 5 or 10 years. Some of the shorter studies, their patients are finished within the study in about 3 months. We were quite busy, we were doing a lot of patient contact, and then when the pandemic hit, obviously all surgery stopped for a period of time and all research activities stopped. Within orthopaedics, because you're dealing with hip and knee replacements, the major outcome is going to be function. Normally the function we would determine in some other studies by data we get from the motion analysis lab. Also a lot of physical examination, and even at the lower level just an x-ray to see how the implant's faring. And because we weren't allowed to bring patients in for research specific activities, we pretty much had no research activity going on at all.
As the studies were paused, we saw all our research nurse colleagues and support colleagues moving out into the clinical areas, and we were left as a team of 4 thinking, okay, what are we going to be doing to try and keep the service going? And we probably had a very short day of thinking, well, all our work is paused that we would routinely do, when we then started putting measures and systems in place to manage the service in the absence of our research support colleagues.
When the pandemic hit, and what happened was we were all told that we had to be deployed to the wards, so which we did. Because we're all working in different specialties, we were moved appropriately. So my previous experience as coronary care, was a coronary care nurse for 15 years. So I was deployed to coronary care, and several members of staff, we were all deployed to the wards. All our studies were put on pause and we were to do shift patterns, which was all quite a culture shock for us because we work Monday to Friday, we don't work weekends, and suddenly we were working shifts and night shift. Also, we were very aware that we had studies that were in follow-up, that we still had all this work to do when we came back. So we knew we had a lot of catch-up to do. But we got there, we did it in the end, but everybody was in the same position.
The research studies were paused, they were all put into suspension. That didn't mean that the patients were in suspension, the patients were still on treatments and needed some level of care during the pandemic.
The last thing I wanted when our nurses were deployed were for patients to phone in and there was nobody to pick up the phone. Patients were at that point in time extremely worried about their own conditions, about themselves, about their families, and that's the sort of questions that they were answered. So we had to have a system in place to make sure that all these questions were answered, and we did. So there were no incidents that I'm aware of over that time of patients not being able to get in contact and not being able to talk to the person that they needed to talk to. So logistically, yes, it was difficult to do, but it had to be done. Our patients are our priority. In research as it is within the clinical service, so we did everything we could to make sure that they were content.
We put in a triage system so that all our patients that we anticipated would be phoning in, that would normally be scheduled in for an appointment or knew that one was coming up, or what we found was they were just concerned and wanted somebody to talk to. So we would triage the calls. We would pass it on to, there were 1 or 2 of our colleagues who weren't deployed, so we would triage the call, pass it on to one of the research support staff to deal with, or indeed the PIs were also available, the principal investigators for that study. We were also asked to help our OC Health department in fielding calls. So again, we would take calls primarily from other members of staff in the organisation, and just take some messages, and then we kind of had a bit of a system in place a couple of times a day. We would go down, hand all the messages over to Occ Health and then come back, and that just enabled the occupational health nurses to facilitate those calls and spend the time with the staff, and we took the messages for them. So that worked out really well, and we just helped them as and when they required that. And it was quite nice to get to speak to staff as well, because it was very quiet down here. We didn't have a lot of contact with members of staff. We were used to it being a really busy facility with nurses, consultants coming in, the patients coming in, but we busied ourselves with putting in new systems and processes, as I said, to ensure that our patients knew they were being looked after, and hopefully to reassure our support colleagues that were up in the clinical areas that their patients weren't being forgotten about.
We did use the time to catch up on other things, continuing with training. Also, this motion analysis lab we have does create a lot of data. Generally what we do is we concentrate on the data that we need, but we have so much more, so it gave us an opportunity to catch up on that. It gave us an opportunity to catch up on some of the X-ray reviews that we do for some of our patients. We recruit a huge number of patients. It does create an awful lot of data, and if the pandemic was to create anything, it's created a break for us to try and catch up with some of that data and get some things finished that may have taken a little bit longer to move on.
But we certainly were research active throughout. There certainly were patients in the hospital who had COVID, and we were able to enrol them in clinical trials. Then along came Siren, which is for the staff, which is a big trial that some of the staff are participating in. The staff have been absolutely great. We didn't have any trouble getting participants to sign up, and they're very keen to come back and comply with the visits in the protocol, which means them coming out of their way every fortnight, coming to see us. We've had a lot of really great interactions with staff. It's been really nice to have them in here, seeing lots of people we don't normally see. Of course, it's a really important study. Obviously, the participants buy into being medical professionals, or at least working in a hospital, some of them. So yeah, it's been a good success. I was a vaccinator myself, and we had preliminary training with the flu vaccine. The board anticipated that there would be greater uptake of the flu vaccine, so we've drafted in extra people. We helped with that, and basically we're able to be trained and supervised and then work independently as vaccinators. So when the COVID vaccine rollout came, we were all ready to go, and we worked around our own work and our people's shift patterns, and some people were kind enough to come in and do bank shifts to help out as well. Highlights, I think, of the COVID period and the lockdowns was being able to participate like that. I'm very keen on vaccinations, so we were delighted to help out with that, and really enjoyed it, and really felt we're making a contribution by vaccinating our peers in the hospital.
As the research studies were starting to come back on board, we needed to ensure that our physical environment was safe for patients to return. So we worked very closely with our occupational health and infection control teams, and we wanted to ensure that obviously whatever had been put in place in terms of advice from Public Health Scotland, from the board, we were complying with as well, and we found that our outpatients department were really key in sending on information to as well, in terms of, well, we are to all intents and purposes an outpatient department as well, although a slightly different throughput of patients. So we worked with them to put guidance in place in terms of ensuring that our facility was fit for purpose, that it was safe, that we were maintaining social and physical distancing, and to give the patients that reassurance, because we knew that they would be nervous about coming back in because they maybe didn't necessarily see it as being essential. But feedback from nurses when we spoke to them in terms of when you were back in touch with your patients, I think they were keen to be involved where they could. All our nurses, and they still do, before the patients come in, they do the COVID questionnaires, the pre-assessment questionnaires over the phone with them, and then again on the day.
We're getting to what I would call relative normality. Most of our projects are open, as I've said, and we're starting to review and approve new projects, which is extremely exciting for us.
We've got a huge portfolio of patients, and we do have a relationship with our patients, which is very nice and comforting. And they're happy to come. They feel that the Golden Jubilee is a very safe place to come because it is a COVID-light hospital.
The robots we have open up a new opportunity for us. The unit's always been very technologically orientated. Some of the early members of the staff were early developers of the navigation navigation system which the robotic system has come from. So we're looking forward to getting involved in some of the research involved in that. A lot of the early work has been done, so we're really looking for a niche that will allow us to do something different. One of the studies which we've started is looking at immediate post-operative function, and what that study would be looking at is how soon can we get a patient into a motion analysis lab after surgery and get useful data. Now with the robot, one of the unique selling points is that it does allow for quicker recovery. So that study is going to feed into the robotic study. Once we know how quickly we can get them in, we can then compare patients who have had robotic surgery with patients who have had navigated or manual surgery to determine how their function is very soon after their surgery. That's really one of the points that gets people moving again, is early recovery after surgery, when you're trying to get people mobilising and get them discharged quickly. If we can actually determine when the ideal point for that would be, that would allow us to move forward with robotic studies.
All the nurses in the department have been, during the pandemic especially, and now are desperate to restart properly and to recruit into the studies. They all love their job and they're happy to work down here, and they're happy for everybody else in the hospital to come and see how they work, and anybody is welcome to come and visit.
Going forward, we see a real excitement in the work that we're doing. We have a new research strategy which was reviewed by our steering group back in May, and we're starting to enact various aspects of that. So we see expansion of our administration team, and we see expansion of our nursing support team as well, and we've got two consultants who've recently come on board who are also very research active, and I'm assisting them with the review and approval of their projects. So all is very optimistic. I think we're all very excited about the years ahead.